Each year, more than 500,000 people around the world are diagnosed with thyroid cancer. Why is this form of cancer becoming more common? What factors increase the risk? What warning signs should you watch for? And finally, can your diet influence your risk or affect your thyroid's hormonal balance? Which nutrients matter most, and are there any supplements that truly help? The rise in thyroid cancer can largely be traced to two key reasons. First, detecting it has become much easier. Thyroid ultrasounds are now widely accessible, and other imaging tests, such as CT scans and MRIs, often serve as the first step toward diagnosis when a thyroid nodule is spotted during an unrelated exam. A suspicious lump or an unusually large nodule will usually lead to an ultrasound. Many people discover these nodules by chance, while others find out because conversations about thyroid health and screening are far more common today. As an endocrinologist, I often see patients who come in specifically for thyroid evaluations, since this gland falls under my specialty. The second factor involves lifestyle. Obesity is directly linked to the increasing number of thyroid cancer cases because fatty tissue, or adipose tissue, is metabolically active. In other words, it produces substances that can influence cancer development. And it's not just thyroid cancer, obesity is also associated with higher risks of colon, breast, and prostate cancers. Together, the greater use of advanced diagnostic tools, poor lifestyle habits, and rising obesity rates have all contributed to the growing number of thyroid cancer diagnoses. Before we go any further, it's important to talk about thyroid nodules. Most of them are harmless, but when should they raise concern? When is it worth looking deeper? In women of childbearing age, about 1 in 2 will have a thyroid nodule, a surprisingly high number, yet the majority are not cancerous. Some nodules, however, deserve closer attention. Those that grow quickly, appear irregular on an ultrasound, have uneven edges, or show central blood flow are considered more suspicious. Darker-looking nodules, known as hypoechoic nodules, are another feature doctors watch for. Even the number of nodules matters. While multiple nodules often point toward a benign condition, a single nodule can be more worrisome. If a nodule is taller than it is wide, contains microcalcifications, or is solid rather than fluid-filled, the risk also increases. Doctors weigh all of these details together before deciding on the next step. It's never just one feature that determines whether a nodule should be investigated further, whether a fine needle aspiration biopsy, FNAB, is needed, or whether other tests or closer monitoring are the right choice. To help make these decisions consistent, specialists use a scoring system called Thyroid, designed to bring more standardization to how nodules are evaluated. So, the first warning sign is a thyroid nodule with features linked to a higher cancer risk. And while many nodules, even some with these traits, turn out to be benign, it's important to investigate the ones that raise concern. Most are harmless, but it's always worth checking when the signs point to something more serious. 1. Thyroid nodules with suspicious features. Although the majority of thyroid nodules are harmless, certain patterns in their structure and imaging results can sharply increase the concern for cancer. Beyond factors like rapid enlargement, irregular margins, reduced echogenicity, and tiny calcium deposits, medical research has identified another important clue: the stiffness of a nodule on elastography, a specialized ultrasound method, can help predict malignancy. A comprehensive meta-analysis published in Radiology in 2020 revealed that nodules registering higher stiffness scores were between 3 and 5 times more likely to be cancerous compared to those with softer consistency. While size alone is not the ultimate deciding factor, it still carries weight. Nodules measuring over 1 centimeter that also display suspicious ultrasound traits typically warrant a fine needle aspiration biopsy, as outlined in the 2015 guidelines from the American Thyroid Association. That said, even nodules smaller than 1 centimeter can prove malignant if they present aggressive features, or if the patient's background includes high-risk factors, such as previous radiation exposure during childhood. Family history is another element that often goes unnoticed. A 2018 study in the journal Thyroid found that having a first-degree relative diagnosed with thyroid cancer nearly doubles an individual's risk of developing malignant nodules. This underlines the importance of targeted screening, particularly for families with a documented history of the disease. 2. Enlarged lymph nodes. Swollen lymph nodes in the neck that feel hard, don't move easily, or show fluid-filled areas on an ultrasound are more concerning than soft, mobile ones. In papillary thyroid cancer, the most common type of thyroid cancer, studies show that anywhere from 30% to 80% of patients already have cancer cells in the neck lymph nodes when they are first diagnosed. Where these swollen nodes appear can also give important clues. Those found in the center of the neck or along the side of the neck are more likely to be suspicious. On an ultrasound, cancerous lymph nodes may lose their normal central fatty area, appear round instead of oval, or contain tiny calcium spots similar to those found in the main thyroid tumor. In some cases, the swollen lymph node is actually discovered before the thyroid lump itself. A large study in 2019 found that in 5% to 10% of patients, this lymph node change was the very first sign that led doctors to uncover thyroid cancer. 3. Voice changes. If your voice stays hoarse for more than 2 weeks and there's no clear reason, such as a recent cold or overuse, it's important to have it checked, especially if it's getting worse. The recurrent laryngeal nerve, which controls most of the muscles that move your vocal cords, runs right next to the thyroid gland. Even a small tumor in certain spots can press on or affect this nerve, changing the way your voice sounds. In more advanced cases of thyroid cancer, studies show that up to 30% of patients notice some kind of voice change. This can range from a slightly rough tone to real difficulty speaking loudly, and in some cases, a breathy voice caused by the vocal cords not closing properly. A simple test called laryngoscopy, which uses a thin camera to look at the vocal cords, can detect even subtle movement problems. Research has found that spotting vocal cord weakness early in people with thyroid nodules can lead to faster surgery and a much better chance of keeping the voice strong in the long run. 4. Difficulty swallowing. When a thyroid tumor grows in a spot where it presses against the esophagus, it can make swallowing more difficult, a problem known as dysphagia. It often starts subtly, with trouble swallowing solid foods, and over time can progress to difficulty with liquids. This is the opposite of swallowing problems caused by conditions like stroke, where it begins with liquids first. The reason here is straightforward: the tumor is physically squeezing, or shifting the esophagus, making it harder for food to pass through. According to research published in Endocrine-Related Cancer in 2019, symptoms like this appear in about 10 to 20% of people with large thyroid tumors or goiters. In more severe cases, the esophagus can be pushed noticeably out of place, something doctors can see on scans such as a barium swallow test or a neck CT. These symptoms may also feel worse when lying down, since gravity is no longer helping food move along. Over time, difficulty swallowing can lead to unintended weight loss or even nutrient deficiencies, which is why catching and addressing the problem early is so important. 5. Neck pain. It's normal to feel a little discomfort when your thyroid is examined, but sharp or ongoing pain in that area is something you shouldn't ignore. Pain that gets worse when you touch the area, turn your head, or swallow can be a sign of inflammation, fast-growing tumors, or, in rare cases, the cancer spreading to nearby tissues. Research published in Thyroid in 2017 found that up to 15% of people with aggressive thyroid cancers had localized neck pain before they were diagnosed. Sometimes this pain can spread to the jaw, ear, or even the back of the neck because of nerve irritation. Unlike a pulled muscle or a minor strain, thyroid-related pain often doesn't get better with rest or common pain relievers. If this type of pain continues, especially if you also notice other signs like a lump in your neck or changes in your voice, it's a clear signal to get it checked right away. 6. Trouble breathing, shortness of breath. Breathing problems linked to thyroid disease often occur when an enlarged thyroid or tumor presses against the windpipe, narrowing the airway and making it harder for air to move in and out of the lungs. This can be especially noticeable when lying flat, as gravity is no longer helping to keep the airway open. In more serious situations, a person may wake up at night needing to sit upright just to catch their breath, a symptom known as orthopnea. Research published in the World Journal of Surgery, 2015, found that significant narrowing of the trachea occurs in about 10 to 15% of people with large goiters or advanced thyroid tumors. Imaging tests like CT scans or MRI can show exactly how much the airway has been reduced, and in some cases, the windpipe's width can shrink by more than half. This can make breathing difficult not only at rest but also during light activity. If left untreated, this type of airway compression can lead to ongoing strain on the lungs and, in severe cases, a dangerous blockage that requires urgent attention. 7. Unexplained cough. A cough that lingers without any signs of infection, allergies, or other obvious breathing problems can sometimes be linked to issues with the thyroid. This happens when a thyroid nodule or tumor irritates the windpipe or nearby nerves, setting off a reflex that triggers coughing. Over time, the cough may show up more often or come in bursts, even when the throat feels completely clear. Although coughing isn't among the most common signs of thyroid cancer, research published in Endocrine Practice, 2018, found that about 5 to 10% of people with malignant thyroid nodules had a chronic cough before they were diagnosed. The challenge is that this symptom can easily be mistaken for asthma, acid reflux, or a stubborn case of bronchitis. What makes it different is that a thyroid-related cough often doesn't improve with standard treatments for those conditions, and may happen more in certain positions, like when lying back or turning the head. Getting a persistent, unexplained cough checked early, especially if it's paired with other neck-related symptoms, can make a big difference in catching problems sooner and improving outcomes. So, what's the right next step? How should you move forward if you're facing this situation? You might be wondering whether certain foods can harm your thyroid, or if others can help protect it. And what about supplements? Do they truly make a difference? We'll explore those questions in this video as well. Before we dive in, I want to remind you, if you find this information helpful, sharing it can make a real impact. Every comment helps spread awareness so more people can recognize the signs early and take action. When a thyroid nodule shows the concerning features we've discussed, or when symptoms point toward possible thyroid cancer, the first step your doctor should take is to check your thyroid hormone levels. This is more than just a lab test, it helps reveal whether the nodule is producing hormones. Here's why that matters. Cancerous nodules rarely produce hormones. So, if your nodule is hormone producing, it's often considered a reassuring sign that it's more likely benign. In that case, treatment focuses on balancing hormone levels rather than removing the nodule. But when the nodule doesn't produce hormones, the concern for malignancy rises. At that point, your doctor may recommend a fine needle aspiration, a simple but precise procedure to collect cells for analysis. The results guide the next steps. In some cases, surgery may be advised. In others, careful monitoring is the safer choice. There's no one-size-fits-all path. Yet for confirmed thyroid cancer, surgery remains the preferred treatment. Acting promptly, guided by clear medical evidence, offers the best chance for both recovery and peace of mind. Let's talk about diet and your thyroid. People often ask if there's a special thyroid diet, or a magic supplement that can boost thyroid function. The truth is, there isn't. What your thyroid truly needs is a steady supply of key nutrients, selenium, zinc, and iron. Iron, in particular, is often overlooked, yet it's essential not only for producing thyroid hormones, but also for helping your body use them effectively. There's no single food plan or miracle pill that will switch on your thyroid. As a thyroid specialist, I can tell you that the focus should be on meeting your body's minimum needs for these nutrients through a balanced diet. You can find them in everyday foods: eggs, seafood, fish, legumes like beans, chickpeas, and lentils, oats, seeds such as chia, flax, sunflower, and pumpkin, and vegetables like broccoli and cauliflower. And about that common myth, no, broccoli will not damage your thyroid. This idea came from a study in which rats were fed only cruciferous vegetables, like broccoli and cauliflower, and developed enlarged thyroid glands. That effect hasn't been seen in humans. In fact, broccoli may help protect your thyroid. You'd have to eat 5 to 8 pounds a day to cause harm, which simply doesn't happen in real life. Other foods that support thyroid health include Brazil nuts and cashews, rich in zinc, magnesium, and selenium, leafy greens like lettuce, arugula, and spinach, and for iron, red meat, and organ meats like liver, which are also packed with vitamins. A well-rounded diet can provide everything your thyroid needs to function well. Iodine is another essential nutrient. It comes from food, not supplements, and many foods today are fortified with it. In inland areas far from the sea, iodine can be scarce, but table salt is iodized, so deficiency is rare. In certain cases, doctors may recommend iodine supplements, but this is the exception, not the rule. That's why I say minimally balanced diet, because even small, regular amounts of these foods are enough to meet your thyroid's needs. I emphasize healthy eating not only to nourish your thyroid but also to help you avoid falling for thyroid detox fads or supplement scams. When a patient has an actual thyroid disorder, such as autoimmune hypothyroidism, the right treatment may be thyroid hormone replacement. This is not a supplement, it's a prescribed therapy to restore what the body can't produce on its own. Understanding the difference can protect both your health and your wallet. Thyroid cancer may be on the rise, but with awareness, timely screening, and healthy lifestyle choices, it's possible to catch it early and protect your thyroid health. Today, we've explored why cases are increasing, the key risk factors, the 7 warning signs you should never ignore, and the essential nutrients that keep your thyroid functioning at its best. Remember, most thyroid nodules are benign, but staying informed and proactive is the best way to safeguard your health. If you've learned something valuable today, take a moment to share this video so others can benefit, too. And if you haven't yet, subscribe to the channel and turn on the notification bell. That way, you'll always be the first to know when I release new, life-changing health insights. Your health is your greatest asset, let's protect it together.